Steve, you bring such a great point into the conversation, which is the limitations of the endpoints that we use. And I completely agree with you. Like it just doesn't encompass, it would be very difficult to encompass every aspect of HS, right?
Yes.
And so we really, when you're looking at the data, I think you have to take it with a grain of salt. And that HiSCR, as you mentioned, really focuses on that abscess and nodule component, but doesn't focus on the draining tunnels, which for many patients is just as impactful on their quality of life as you can imagine, trying to change bandages and deal with draining tunnels, especially on your backside when you're trying to sit all day or something like that. It's really horrible. So thank you for bringing that up. Super important point that I had failed to mention. So as we look further into the pipeline, remibrutinib, I find that to be so interesting, Steve.
Me too. And it's funny, before we started talking about remibrutinib, I didn't really know what Bruton's tyrosine kinase was. Yeah. You know, like these drugs teach me new things. I'm like, what does it inhibit? I got to go read up on that. And it's an interesting one because we see some of these overlaps, right? Like all three of the drugs that were approved for HS also were approved for psoriasis. So it was kind of like, okay, that we get it, some similar pathways. Well, remibrutinib is approved for spontaneous urticaria. Yeah. And so you're going, oh, this is kind of interesting. What's this overlap in inflammatory pathways through this BTK with, you know, because that's not one that I typically think of. You know, I think like arthritis and HS, yeah, you see sometimes together. But yeah, the urticaria isn't one. But it is kind of funny because we've come to recently appreciate how much important itch can be in HS too, where a lot of the patients are really itchy. So yeah, that's an exciting one to see how it's gonna, and the trial's underway. So hopefully it'll be coming out soon. I do have one patient I've treated with it because she did have urticaria and HS, and it was perfect timing. I go, hey, there's a new medication for your urticaria, and we're gonna start it because you also have HS, and I have reason to believe it will work for both.
Yeah.